Let's let's move towards the clinical uses of penicillins, and we will discuss the uses class-wise as they have different spectrum of activity in each class. So we'll start with the narrow spectrum penicillins, which are penicillin V and penicillin G. Now, penicillin G is a prototypical drug of all penicillins, and it has a limited antibacterial spectrum. So they are active against these antibiotics. They are active against gram-positive cocci, which are round shaped, and they are active against gram-positive bacilli, which are rod shaped. The examples of gram-positive cocci are streptococci, which are very notorious for causing pharyngitis and upper and lower respiratory tract infections. They have activity against pneumococci, and they have activity against staph, which is staphylococci. So all these gram-positive cocci, penicillin G has activity against all these streptococci. They also have activity against gram-positive bacilli, which includes Clostridium and actinomyces. Now there is another class of gram-positive bacteria which have a spiral-shaped structure, and they are known as spirochetes. So the penicillin B and penicillin G, they also have activity against these organisms. So these organisms, they have a spiral-shaped structure. And the examples of any spirocate bacteria is Treponema, which is notorious to cause syphilis in human beings. So penicillin G, it is a drug of choice for the treatment of syphilis, and one injection, and it is given as a single injection. It can be repeated after 1 to 2 weeks, and it is the drug of choice in the treatment of syphilis. So this is the spectrum of penicillin G and penicillin V. Now, penicillin G is usually given in the IV formulation, whereas penicillin V is acid stable and it is available in the oral drug, and it is used mainly in the treatment of oropharyngeal infections. So this was all about penicillin G and penicillin V, and they were the narrow spectrum penicillin A susceptible agents. Now we'll move towards the anti-staphylococcal penicillins, which are very narrow spectrum penicillins, which means that they have activity against only they are primarily used for the treatment of staphylococcal infections, as the name indicates, because they're called as anti-staphylococcal penicillins. So they have activity against staphylococcal infections. They also have activity against some pneumococci, and but due to the nephrotoxic potential of the drugs in this class, they're no longer used, and they used to be used for the treatment of staphylococcal infections, but now the resistance is too much and these drugs are not used and they are almost obsolete. Dicloxacin, it was available in the market some time ago, but it's now obsolete. So these drugs, because they are very narrow spectrum and the resistance rate is very high, so these drugs are almost obsolete from the use. Also, that we have grown resistant strains of staph, which are normally caused as MRSA, which is methicillin resistant strains of Staphylococcus aureus. So because of the emergence of all these kind of resistance, these drugs are now obsolete. But we must know, because they are the second group of the penicillins. The third class of the penicillins, which are extended spectrum penicillins. So these are the most widely used penicillins in nowadays, and they have a very broad spectrum. They have a very wide spectrum of infection. So the first, there are three subclasses in this class as well. We have aminopenicillins, we have carboxypenicillins, and we have uridopenicillins. The amoxicillin and ampicillin, they have activity of the penicillins, the activity against the class that we discussed at the first place, and along with that, they also have activity against gram-negative rods. So they have activity against E. coli, which is a gram-negative bacteria, and it is responsible for causing a wide variety of infections, including pneumonia and UTIs and bloodstream infections. It is effective against H. influenza, which is common to cause, which is very notorious in causing the infections of the respiratory tract infections. It has activity against listeria, and ampicillin is basically the drug of choice in the treatment of listeria meningitis, because listeria, it causes meningitis in humans. It also has activity against Proteus mirabilis. However, the resistant strains also occur. So along with the activity which that we started in the penicillin B and penicillin G, that it covers all these bacteria, and along with all these bacteria, it also has activity against all these gram-negative rods. So it has a very broader spectrum of antibiotics. They're also active against enterococci infections and enterococcal and listeria infections. Ampicillin is usually synergistic with aminoglycosides as well. The carboxypenicillins are not longer used. They used to be used because the carbenicillin, it has activity against pseudomonas as well. But now the most commonly drugs that are used are of this class, uridopenicillin. So it has piperacillin, and the unique property of piperacillin is this, that it is active against pseudomonas, which is a very notorious gram-negative rod in hospital settings, and it is very notorious for causing a wide variety of infections, including respiratory tract infections, bloodstream infections, and urinary tract infections. So this property is unique to this subclass of the extended spectrum penicillins. Now, it is active against Pseudomonas. It also active against Enterobacter, which is another gram-negative rod, and it is responsible for causing a lot of infections in humans. It also has activity against Klebsiella, which is very notorious to cause pneumonia and urinary tract infections in human beings. It also, most drugs in this subgroup have synergistic action with the aminoglycosides. And piperacillin and ticarcillin, they're also susceptible to penicillinases, so they are often used in combination with penicillinase inhibitors. So we use these along with the penicillinase inhibitors, which are clavulanic acid, and tazobactam. So these drugs are usually given in combination with these drugs in order to have a broader spectrum of actions. So the extended spectrum penicillins, they are used to treat a wide variety of infections, including pneumonia, bloodstream infections, central nervous system infections, urinary tract infections, and so in adverse effects, penicillins, they causes two kinds of adverse effects. They might cause allergic reactions, or they may cause gastrointestinal disturbances. So in allergic reactions, it includes urticaria and severe pruritus, and this is a skin manifestation of all the penicillins. All the penicillins, they can cause fever in the patients who are taking the penicillins, and they have the ability to cause hemolytic anemia as well. So the neutropenia is most commonly caused with nafcillin, and interstitial nephritis was most commonly seen with the use of methicillin. Maculopapular rash was seen with the use of ampicillin. And in the GIT, they have the tendency to cause nausea and diarrhea, and they may occur with oral penicillin, especially with ampicillin. GIT upset may be caused by direct irritation or by the overgrowth of gram-positive organisms or yeast. Ampicillin has been is very notorious to cause pseudomembranous colitis. This was all about the penicillins.